Which of the following is the most serious complication of epiglottitis in a neonate child? A. Laryngomalacia. B. Asphyxia. C. Tonsillitis. D. Pharyngitis. Check mark correct answer. B. Asphyxia. Explanation. Epiglottitis is inflammation of the epiglottis, usually causing high fever, drooling, difficulty swallowing, stridor, respiratory distress. The greatest danger is complete airway obstruction, leading to asphyxia. Exam tip. Epiglottitis equals airway emergency. Which of the following is not a clinical feature of strangulated bowel? A. Tachycardia. B. Disappearance of abdominal pain. C. Fever. D. Acidosis. Check mark correct answer. B. Disappearance of abdominal pain. Explanation. Strangulated bowel causes severe abdominal pain, fever, tachycardia, metabolic acidosis, peritonitis. P. Pain usually persists or worsens, so disappearance of pain is not a typical feature. 3. Which route is best for adrenaline, epinephrine, during severe anaphylactic shock? A. IM. B. IV. C. SC. D. All. Check mark correct answer. A. IM. Explanation. The recommended first-line route for epinephrine in anaphylaxis is intramuscular, IM, into the mid-anterolateral thigh. IV epinephrine is reserved for refractory cases managed by experienced clinicians because of the risk of serious arrhythm. MEAS. 4. Which is a clinical feature of bowel obstruction? A. Colicky abdominal pain. B. Abdominal distension. C. Vomiting. D. All of the above. If this option exists, check mark best answer. All are features. If forced to choose from AC only, A. Colicky abdominal pain is the classic hallmark. Explanation. Common features include colicky abdominal pain, vomiting, abdominal distension, constipation, obstipation. Which is a clinical manifestation of a bladder stone? A. Pain in the testes. B. Hematuria. C. Strangury, painful, slow urination. D. None. Check mark correct answer. B. Hematuria. Explanation. Bladder stones commonly cause hematuria, dysuria, urinary frequency, suprapubic pain, intermittent urinary stream. Although strangury can occur, hematuria is the classic exam answer. A patient presents with 6 episodes of projectile vomiting, has a history of alcohol use and gastric problems. Before the physical examination, the nurse takes a history. What type of assessment is this? A. Initial assessment. B. Focused assessment. C. Time-lapsed assessment. D. Emergency assessment. Check mark correct answer. B. Focused assessment. Explanation. The nurse is assessing a specific complaint, vomiting, rather than performing a complete assessment. What is the correct order of wound dressing? A. Irrigate right pointing arrow, clean right pointing arrow, debride right pointing arrow, apply medication. B. B. Clean right pointing arrow, irrigate right pointing arrow, debride right pointing arrow, apply medication. C. Debride right pointing arrow, irrigate right pointing arrow, clean right pointing arrow, apply medication. D. Clean right pointing arrow, debride right pointing arrow, irrigate right pointing arrow, apply medication. Check mark correct answer. B. Clean right pointing arrow, irrigate right pointing arrow, debride right pointing arrow, apply medication. Explanation. The usual sequence is clean the wound, irrigate with appropriate solution, remove non-viable tissue, debridement, if indicated, apply medication, dressing. 8. Which statement about CPR is true? A. 30 compressions, 2 breaths in adults. B. 15 compressions, 2 breaths in adults. C. 30 compressions, 1 breath in adults. D. 15 compressions, 1 breath in pediatrics. Check mark correct answer. A. 30 compressions, 2 breaths in adults. Explanation. For adult CPR, 30 compressions, 2 rescue breaths. What is the most important aspect of burn management during the first 24 hours? A. Wound dressing. B. Fluid resuscitation. C. Antibiotics. Check mark correct answer. B. Fluid resuscitation. Explanation. T. The greatest immediate risk after major burns is hypovolemic shock due to fluid loss. Priority: airway, breathing, fluid resuscitation. A patient with diabetes says, "My high blood sugar won't affect my future vision. And I can do everything." Which Gordon functional health pattern does this statement reflect? A. Self-perception, self-concept pattern. B. Coping stress tolerance pattern. C. Role relationship pattern. D. Value belief pattern. Check mark correct answer. A. Self-perception, self-concept pattern. Explanation. T. The patient's statement reflects how they perceive their health and themselves. Which of the following does not occur during the proliferative phase of wound healing? A. Wound contraction. B. Collagen formation. C. Epithelialization. D. Release of vasoactive substances. Check mark correct answer. D. Release of vasoactive substances. Explanation: phases of wound healing. Inflammatory phase, vasoactive substances released. Proliferative phase, granulation tissue. C. Collagen formation, epithelialization, wound contraction, maturation phase. In hypotension, which fluid should be given? A. Dextrose 5%, D5W, B. 3% normal saline. Check mark best answer. Neither option is ideal. Explanation: the preferred initial fluid for hypotension due to hypovolemia is 0.9% normal saline, NS, or Ringer's lactate, RL. D5W is not suitable for initial volume resuscitation, and 3% saline is reserved for severe symptomatic hyponatremia or specific neurological conditions. Warning. Warning: this question appears incomplete because the correct option, 0.9% NS, is missing.